Bismillahirrahmanirrahim. Today we will have case quiz number 52. Case data: 24 years old female. During her work, she suddenly fell into the ground without any loss of consciousness and told her colleagues that she had a complete paralysis of the left lower limb. She was unable to stand and was taken by the ambulance to the emergency department. She had no other neurological symptoms and is otherwise healthy. She had no relevant past or family history, was not on any medications, never smoked before or drank alcohol. She works as a sales assistant on a bookshop and was divorced 4 weeks ago. On examination, she looks well. The only abnormalities are in the nervous system. She was completely oriented and the mini mental state score is normal. The cranial nerves and neurology of the upper limbs and right lower limbs are normal. The patient is unable to move the left leg on request. However, muscle tone is normal. Coordination couldn't be tested because of the paralysis. Superficial sensation was completely absent below the margin of the left buttock and left groin region, with clear transition to normal above this level. Vibration and joint position sense were also lost in the left lower limb. There was normal withdrawal of the leg to nociceptive stimuli such as firm stroking of the sole and increasing compression of the Achilles tendon. The superficial reflexes and tendon reflexes were normal and the palmar response was flexor, so negative Babinski sign. So, what is the diagnosis? Remember that this case may be faced in rheumatology or internal medicine clinic, but it is actually a neurological or even neuropsychiatric case. And the answer is dissociative disorder. Dissociative disorder. This is the new name for hysteria. So they are the same disease. Hysteria is the old name and dissociative disorder is the new name. Discussion. The patient has hysteria, now renamed as dissociative disorder. The clue for this case are: number one, the bizarre complex of neurological symptoms and signs which don't fit neuroanatomical principles, such as the reflexes are normal, the withdrawal response is normal despite the paralysis. Number two, the patient's lack to concern, known by French term of labile indifference. Number three, the onset in relation to stress, which is the loss of partner. She was recently divorced. Number four, secondary gain, removing herself from parental home, which is painful reminder of her splitting from the partner. Actually, when she was divorced, she returned to her parent home, and this will remember her every time and time that she is divorced and she has social problem. In fact, none of these in its own is specific for the diagnosis of hysteria, but put together they are typical. In any case of dissociative disorder, the diagnosis is one of exclusion. In this case, the neurological examination excludes organic lesions. It is important to realize that the disorder is distinct from malingering and factitious disease. The patient is not malingering. The patient thinks that she is diseased. But malingering, the patient knows that he is not diseased, but he lies. It is a manner of claiming or uh, or lie, yes. But hysteria, the patient thinks that he is actually diseased. The condition is real to patient, and they must not be told that they are faking illness or wasting the time of staff. This will worse the case. If you told a hysteria patient that you have nothing, this will worse his condition. The management is to explain the dissociation. In this case, it is between her will to move her leg and its failure to respond, as being due to stress, and that there is no underlying serious disease such as multiple sclerosis. A very positive attitude that she will recover is essential, and it is important to reinforce this with appropriate physical treatment, in this case physiotherapy. So this is why we bring this case here, because it touches our specialty in the area of physiotherapy or rehabilitation. The prognosis in case of recent onset is good, and this patient made a complete recovery in 8 days. Dissociative disorder frequently present with neurological symptoms, and the commonest of these are convulsions, blindness, pain, and amnesia. Clearly, some of these will require full neurological investigations to exclude any organic disease. The key points for this case are: number one, dissociative disorder frequently present as neurological illness. Number two, the diagnosis is a matter of exclusion for dissociative disorder. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 53. Wassalamu alaikum wa rahmatullahi wa barakatuh.